All right. So I haven't been doing these COVID updates because it's been pretty non-eventful. Although we have been, you know, steadily increasing in the last several days. Um the positive cases have been going up, but today we had a huge jump. So we're at 322 today. Um, no deaths, so that's a good thing. But we had 10 deaths yesterday. So that's pretty bad. Um, so the daily average cases for 7 days for the state is 158, and we're running at 3.5%. But in Honolulu, uh, so 213 cases just in Honolulu, right? And so the 7 day average is almost 115 cases. So that's well above the 100 cases that would move us back up to tier one. We're still below the 5%. So we're at 4.4, but we're kind of like creeping up there, right? Um, so it's not looking good. It's not definitely not looking like we're going to move to tier three. And it looks almost inevitable that we're going to move to back to tier one, especially since like I don't know if this is what we're seeing is a bump up in Christmas or New Year's. I mean, right? I mean, New Year's was just, what is it? Today's the 7th, so it's like just, 7 days ago. And I'm pretty sure a lot of people did gather Christmas too. But we're also seeing like some clusters happening at Queens, right? And it's not anything big that would result in such a big number like this. At Queens, I think it's like 20 something people at Queens. So this is definitely in the community. Um, I don't know if they're testing for that new strain. I mean, we've been hearing that the new strain of COVID that's supposed to be more contagious, that, we've been seeing it pop up all over the continental US, right? We haven't heard anything here. I don't know if we're even testing it here, um, but I would suspect that it's probably down here already. Um, but the symptoms are the same, the sickness is the same. It's just that it's more contagious. So I don't know what, I mean, if that leads to like a bigger increase every day in positive cases, then for sure we're going to go back to tier one, right? We haven't heard from Blangiardi, and in fact, it's been kind of quiet since Caldwell left. I know whenever we had this big bump up, Caldwell would have a press conference and talk about it. But we haven't heard anything from Caldwell or his administration. Um, so hopefully, like once they're up to speed on things, they can come out and let us know what they're gonna do. I'm hoping that they redo the tier system. Um, so here's the tier system, right? Let me make it bigger. Where is it? Okay, here. So here's our tier system, right? Currently, we're in tier two. We're in the orange section. Um, so that's 50 to 100. Oh, I thought it was 14-day average. I believe it's 14-day average. I don't know why it says 7-day average here. Um, yeah. It says for the last 2 consecutive weeks. So it's a 14-day average. And yeah, so we're over the 100 cases already, right? We're still below 5%. So I don't know if like we have to meet both of these and then we move up, or we hit one of them and then we move up. I don't know. But either way, it's not looking like we are going towards tier three. So, and I don't know if there's anything we can really do about it. I mean, we've done as much as we can as far as like from the government standpoint, right? As far as the guidelines and stuff. I mean, we're still taking in travelers, but I don't know how much of those are travel related. Um, I don't think a lot of it is travel related, but I don't I don't know what else we can do. I mean, I don't know if it is something that the government can do to make us go back. Because I mean, you're right. You can't control a virus, right? I mean, a virus is going to do what it's going to do, and you know how it's being spread. We still don't have a lot of information. We're wearing masks. I mean, everywhere I go, and I don't go a lot of places. Um, People are wearing masks. So, you know, if you go to a restaurant, if you go to shopping mall, uh, you know, I go to the driving range, everybody's wearing masks. Um, so I don't know if, you know, I don't think it's the masks, right? I mean, the masks is not slowing the thing down. Um, and then also, like we saw in the news, right? The cluster is at Queens. So if the hospital, you know, if Queens Hospital, I'm assuming they're doing everything that they can do, everything possible. So they're washing their hands. I mean, the only thing I think they can't do is social distance. Um, but you know, I'm sure that you know everybody's wearing masks. I'm sure the patients are wearing masks too. I would think. Um, you know, they're washing hands and they're you know sterilizing things. I mean, I would think that they would be doing behavior wise, right? They would be doing everything that um, the Department of Health wants us to do, and they're still you know having cases there. Um, I believe all of the caregivers or anybody who has contact with patients are vaccinated, right? They got the first vaccination, so they're still not immune, right? They don't have um, the full effects of the vaccination yet. So, um, and I think this outbreak happened during the same time that they were implementing the vaccinations. So, I mean, we saw that in Europe too, right? When Europe first started giving out the vaccinations, they were having a huge spike in cases, and then that spike carried through the vaccination process. So we still haven't seen the number drop because of the vaccinations yet. So we're gonna have to wait on that. But yeah, I mean, I don't honestly, I don't know what else we can do. I'm assuming this number is gonna probably keep bumping up, right? Because the way the COVID works, the more people that have it, then kind of more people that it spreads to. Um, and I would think like if you're not asymptomatic, uh, you're not being reported, right? Because you're not being tested. So there's the actual number, right, is probably higher than this. Um, you know, of people that have it out in the wild. So I'm assuming that this is the number who of people who are sick and who you know suspect that they have it and went down and got themselves tested, and that's a pretty big number. I don't know if that's the biggest number that we've had. What's the biggest number that we've had? 353. So it's not quite the biggest number, but it's right up there. It's the third biggest day, looks like. Yeah, third biggest day. So, yeah, I don't know. I don't know what else we can do. I mean, we're all wearing masks, right? We're all social distancing, right? Uh, um, New Year's was nuts, right? I mean, we know people are having parties, right? Because nobody's gonna blow fireworks, and this year's fireworks was nuts. And so nobody was blowing fireworks just by themselves, right? They were having people over and having, parties and gatherings and stuff like that. So maybe that contributed to this big number. And then I don't know how long that's gonna last. Maybe it might last a couple of days. Maybe it'll carry on for another week or so. But I don't think we've peaked yet. Um, so yeah, I mean, I don't know what else we can do. We're normally we're wearing masks. Normally we're social distancing. Really, the only thing that I know that works for sure is like you stay away from people, right? When we had complete lockdown, the numbers like dropped to nothing. Uh, and as long as we're kind of out and about, we're gonna have the numbers. But again, we're still like pretty low nationwide. Like this is like a really small number nationwide. Uh, So again, it's kind of like the tier system. I'd hate to see us go back to tier one for businesses. The businesses, I know they're doing everything they can. When we go to pick up food, uh, you know, everybody's wearing masks. I know that the businesses are cleaning everything and trying to be as safe as possible because I know for sure that they don't want to go back to tier one. So yeah, I mean, I don't know what else we can do to bring that number down. I think at this point we're just gonna have to wait and see, and maybe the number will just kind of drop down. Hopefully, this is just a 1 day spike, and all's good, right? One place we know that's gonna have a big spike for sure in cases is gonna be Washington D.C., right? So they had that big protest rally. I think there were like thousands and thousands of people that showed up there. And I mean, a lot of them were wearing masks, but there were a bunch of people that weren't wearing masks too. So I'm pretty sure they're gonna have, you know, a high number of COVID cases out there. California is still doing bad. New York is still doing bad. Yeah, I mean it's winter time, right? So yeah. Anyway, so I've been kind of going through the dashboard data. I've been going through the spreadsheet because it seems like it's a lot easier for me to just make my own charts and stuff from the data. This dashboard here, especially like on mobile, it kind of sucks. Like this thing, it doesn't translate right on my phone, and the numbers sometimes are readable and sometimes they're not. Um, so yeah, I only look at this when I'm on my desktop. Okay, so the vaccination, like I've been seeing people on Facebook, people, friends that are in the medical industry, and they're getting vaccinated, so that's great. Because I'm always worried about them, people who, especially if they work at the hospital, like like even if you're not directly in contact with patients, they're walking around and you're breathing the same air as them. So it's pretty good that most of the people there are vaccinated. And again, they'll have to wait another couple of weeks before they get the next vaccine, right? To be completely vaccinated. So that'll be good. Um, but I kind of want to see what the number the number was, because let's see. So we have received 82,000, almost 83,000 doses of the vaccine. And in 3 weeks, right? 26,000, 3 or 4 weeks, right? 26,000 people have been vaccinated. So that's pretty good, right? So I bust out my trusty spreadsheet. And so that comes out to like almost 8,700 vaccinations per week and about 1,200 per day, which is about right. I mean, I think Josh Green was saying that they're doing about 1,200 a day. That's pretty good. So out of the 83,000 vaccines, we have about 56, 57,000 left. Um, so we haven't gone through even half of it yet. And I think it came out to, what was this? Oh, how long it's going to take us to use up the 83,000 vaccines, right? At 1,200 per day. And it came out to like 67 days. So what is that, like between 2 and 3 months? Just over 2 months, right? To get through all of this. And it's been like a month, maybe. We should be halfway. We're not, but I'm assuming they're gonna kind of ramp it up and get it out faster. So by the end of this month, I think we should be done with the 83,000 vaccinations. And then I don't know when the next batch is supposed to come in. And then they'll start vaccinating. Uh, I guess the general public is coming up next, right? So, yeah. So that's where we are. So, what are you guys doing during this, especially during the holidays? Like, it was kind of a bummer, right? Like, there's no Christmas parties. Usually I'd, be visiting friends and family and didn't really do a whole lot of that. I did a lot of fishing, where you could do a lot of social distancing. But I, for one, stayed home and watched a lot of Netflix. And so if you guys are looking for something to watch, because there's not really a lot of good things on TV, I'm not into the whole like masked singer and masked dancer TV shows. So I watch a lot of Netflix. And there's two shows that I really, really enjoyed. And I would highly recommend if you guys want to spend, some time, if you have time to watch television. And the first one is on Netflix is Cobra Kai. Like, I don't know how this translates to like younger generation, but like I grew up in the 80s. And so like Karate Kid was kind of a huge like success during that time. And I think there was like what, 4 or 5 Karate Kid movies before they rebooted it with Jackie Chan. So the Netflix TV show, if you guys haven't seen it, I mean, come on, like that's like the probably the one of the best, you know, TV series out there right now. The writing is great. Um, the the karate, the fighting, choreography, not that great. Like they're not, but even Karate Kid, the movie, right? Like Daniel, like Ralph Macchio, he's not a. I don't even know if he's an athlete. So like karate wise, you kind of have to let your imagination, uh, you know, you have to let your imagination go with it and just okay, he learns karate. Okay, that's good. The kids in the show are probably not athletes too. Like a lot of them, it's kind of like the kids are kind of like a mix of like the Bad News Bears and the Goonies, and so some of them actually can do like are kind of believable in doing the karate. But then a lot of it is not. But that's not the point, right? The point is it's entertainment, so you just got to be entertained with it. Um, but the great thing about the show that I really enjoy about the whole series, and this was season 3, is the how they took the Karate Kid movies and they kind of expanded that whole universe. So the characters now are being developed more. In a movie, you only got 2 hours, right? So there's not a lot of character development. But the character of Johnny Lawrence, who was the bad guy in the original Karate Kid, he was a spoiled rich kid, right? and Daniel LaRusso, uh, they expand on the character. So, and what they're doing in season three, which was great, was they actually brought in um, characters from Karate Kid 2, which is when Mr. Miyagi took Daniel to Okinawa. And they have, I think, three characters from Karate Kid 2 in season three. Um, and then they also are, what I find is really interesting is the bad guy, which was Johnny's teacher or Johnny's sensei, um, Sensei Keen. He's like the bad guy, right? At the end of Karate Kid, the original movie, Mr. Miyagi, you know, um, beats him up in the parking lot. But he's kind of Keen is like a really sleazy character. Like he's a real bad guy, but he's a great character. And they really fleshed out his character in season three, and that's what I really enjoyed about it. So you get to see like him. He was supposed to be a war hero, war vet, and they kind of go back. They have flashbacks and stuff, and go into his character there. So yeah, I mean, Karate Kid, man, I love what they're doing with Cobra Kai, uh, and the relationship between Daniel and Johnny Lawrence. Um, it makes for super good, super fun. I mean, I I would if I didn't need to if I could stay up till like 3 a.m. I would have been watched the whole thing. But I think I made it through maybe most of the episodes. I think I had like one or two episodes left the next day, and I just pretty much binge watched it all at once. And the other one, which is okay, I'm a huge Star Wars guy, right? I love Star Wars. Um, it's a toss up. It's a toss up between Cobra Kai um, and the Mandalorian, because the Mandalorian season two is just incredible. Like if you were disappointed by the Star Wars movies, um, the what is it? The sequel series episodes. What was it? 7, 8, and 9, with Ray and Finn and all of that. If you were disappointed, which a lot of people were trilogy, The Mandalorian is takes you back to Star Wars days. I mean, it's filmed like Star Wars. The first season of The Mandalorian didn't really have that Star Wars feel to it, although it was set in the Star Wars universe. You didn't have, I mean, other than the little baby Yoda, like you don't really feel like the force is around, right? And also like you didn't really see the empire. Like where's the empire, right? The empire was supposed to have been dismantled. Um, but in season two, you're back in the Star Wars universe. The empire is back. The force is there. You have space battles, and they bring a lot of characters. If you followed the Disney animated Star Wars series, Star Wars Rebels, Star Wars Clone Wars, those are all, and a lot of people don't watch those things because they're cartoons, but those series, because they're television series, really did flesh out the universe more, and those series are canon, right? So they're the they're actually what happened in the Star Wars universe. So whenever they make movies, they have to kind of take those TV series into account and the things that happened there. And so they're bringing those characters that were from the animated series. They're bringing them into the live action series, The Mandalorian. And they're gonna have spin-offs with Boba Fett. So Boba Fett's gonna have a spin-off. Um, I don't know. There's talk of an Obi-Wan spin-off. Um, there's talk of a Rogue One prequel. I don't know. But whatever the case is, two thumbs up for the Mandalorian. Uh, if you have free time, looking for something to watch, definitely Mandalorian and Cobra Kai. The good thing about those two series, 30 minutes each. So they're short. So you don't need to you know, spend an hour watching each episode. So that's basically what I've been doing. I've been watching that, watching some other programs on Netflix. Um, Geez, what was the other one I watched on Netflix? Oh, it was a Japanese um, manga, live action manga series. What was it called? Um, oh, Alice in Borderland. And it sounds like Alice in Wonderland. It's not. Alice is actually a guy. It's a Japanese guy. So that was actually pretty good. So anyway, yeah, that's what I'm watching on Netflix. I'll probably do more fishing. I'm still gonna social distance. I'm still gonna, if I go out, I'm gonna wear my mask. Uh, and I'm just gonna hope like this number goes down. And at some point, like hopefully this year we go at least down to tier three, um, so that we can actually spend time with friends and family and actually go out and do stuff and support our businesses and um, actually like start socially living a life. So yeah, anyway, that's what I got for you today. My COVID update. Um, Hope you guys take care, be safe, and let's bring those numbers down.